PCOS, PCOD, or polycystic ovarian syndrome. What is PCOD or PCOS? That is polycystic ovarian syndrome, or PCOS is a hormonal endocrine disorder of ovary in women in all over the world. Other name for PCOS is Steen-Leventhal syndrome. As the name indicates, multiple cysts in the ovary is called polycystic ovary syndrome. And the size of ovaries in women with PCOS are 2 to 5 times the normal size. Undiagnosed and untreated PCOD is a leading cause of female infertility. PCOS affects 4 to 6% of women. The full-blown syndrome of hyperandrogenism, chronic anovulation, and polycystic ovaries. Because of wide variety of clinical symptoms and biochemical features, exact definition of polycystic ovary syndrome is least understood and can be confusing. According to Rotterdam criteria, definition of PCOS contains 2 out of 3 following criteria. First is oligomenorrhea or anovulation. Second is hyperandrogenism, which may be clinical or biochemical. Third is polycystic ovaries with exclusion of other etiologies. Hormonal and biochemical changes are responsible for PCOS symptoms. There may be abnormality in the 4 active compartments. First, ovary. Second is hypothalamus pituitary compartment. Third is peripheral fat. And fourth is adrenal glands. Abnormality in ovarian compartment is responsible for hyperandrogenism in PCOS. Ovaries in women with PCOS are 2 to 5 times the normal size. Hormonal changes in PCOS. First is hyperandrogenism. It means increased level of total and free testosterone. High intra-ovarian androgen concentration inhibits follicle maturation, results in inactive granulosa cells with minimal aromatase activity for conversion to estrogens. Second is increased LH without increase in FSH, which leads to increased LH-FSH ratio. Clinical symptoms. First is menstrual dysfunction from amenorrhea to oligomenorrhea. Menarche tends to be delayed, irregular menstrual cycles or 4 to 6 menstrual periods per year. Acne. Severe acne in teenage years is very common finding of PCOS. Obesity. About 50% women with PCOS found obese. Obesity is in PCOS linked to insulin resistance, diabetes mellitus, and increased risk of cardiovascular disease in later life. Hirsutism. Excess hair growth on the face and body is called hirsutism. Alopecia means hair loss and male pattern baldness. 6 is acanthosis nigricans, that is hyperpigmentation of the skin, dark skin. Infertility is the common problem in PCOS women. For more updates on healthy lifestyle and medical problems, visit www.askmeforadvice.com. Thank you for watching. Do not forget to like and subscribe.